Perfect. Welcome, everyone. It's Wednesday and another edition of Getting Ready for the Recovery. It's the DeKalb County Unites webinar series that we're doing every Monday, Wednesday, and Friday at 2 p.m. Mondays, we usually have a banker, accountant, and our own Dr. Jock Sommese on to talk about the PPP program and the EIDL program. Wednesdays, we usually bring subject matter experts like we did today to just talk about a wide variety of shelter-in-place related issues. And then Friday, we have our small business spotlight, which we bring on local small businesses that have been able to figure out how to do things differently during the COVID-19 crisis and be able to share a lot of the insight that they have in order to continue to generate revenue and to stay relevant with our customers. So you know what DeKalb County Unites is. We are a grassroots movement of a bunch of people from the government sector, the private sector, the nonprofit sector, as well as Northern Illinois University that came together to figure out how we can make a positive impact on the small business community. That is our singular focus, and there's three things we've gone after really hard to be successful at. One is we picked up the phone and we called all the major employers in the county and found out and gave them ideas on how could they redirect some of their spending right now to the local economy. And in some ways, a lot of them had budgets already, so we told them we asked them if there was a way that they could accelerate their spending, and over 50 of them did just that. They spent money locally, they accelerated their spending, and they drove a lot of dollars in the local economy, which was fantastic. The other thing is our DeKalb County Unites website. We have a wealth of information up there. Links to documents on the stimulus package, as well as links to our previous webinars, a Q&A section. There's just a wealth of information out there. If you were looking for answers, DeKalbCountyUnites.com is the place to go for that. And then the third initiative we did is this webinar series here today that you are attending. So welcome everyone. I did want to introduce our panelists today. First, I'm Cohen Barnes with Sundog IT. I'm a local small business owner here in DeKalb County. We have Courtney Strohacker here. She's with the DeKalb County Convention and Visitors Bureau. She's going to help me make sure we get all the questions answered today. We have Bill McMahon from the Lincoln Inn and Faranda's Banquet Center. We have Dr. Jock Sommese with the Small Business Development Center. And then Lisa Gonzalez and Greg Maurice are here with DeKalb County government and the health department to be able to shed some light on a wide variety of topics today. Topics like Governor Pritzker's new announcement, what does that look like, with the stay-at-home order, Restore Illinois, you name it. So I encourage everyone attending. The whole point of this is to get answers to your questions. So feel free to, if you want to ask us a question, just move your mouse down to the bottom of your screen. You're going to see an icon for Q&A. Just click on that, type in your question, and Courtney and I will make sure that we get your question in front of these experts and hopefully get you an answer. And if we don't or we miss something, please go to DeKalbCountyUnites.com, go to our Contact Us page, ask us anything you want, and we will make sure that we put you in contact with the person that has that answer in order to allow you to mentally just move on or start planning for whatever you need to plan. So that's it. Welcome, everybody. I'm super excited to have you on today. We've had a lot of questions health related from obviously the restaurant industry for sure, but individuals just wondering how they should go about when they're outside. But then also offices. What does that look like? Like a Sundog here, I have people in my workplace. We're going on site and just looking for some guidance at all. And then retail establishments as well. So those downtown small business owners with storefronts that are going to open up at some point. What does opening up look like? And I know there's some things that you guys can give us an explicit answer on, but I know there's other things that you may not be comfortable with saying this is how it is. So we're really looking for, and we're not going to hold anyone accountable to what you say. We're just looking for some guidance to give us so we know how we can at least start planning and have some direction based off of the insight that you give us. So I know that we wanted to start probably with Greg on the stay-at-home order that is going on. Can you shed some light and bring us up to date on what's going on since I think it was May 1st?
Sure. Basically, what I wanted to share was updates on some just basic information, the frequently asked questions that are out there for businesses and operations right now that was put out by the Illinois Department of Commerce and Economic Opportunity. So I wanted to share that information, and this is based on the new stay-at-home order that went into effect May 1st. Essentially, I think one of the big changes, good things that are out there is not only essential, but it also allowed non-essential retail stores to reopen for pickup and outside store delivery. So the employees still need to follow social distancing requirements and wear a mask if they're not able to keep within a 6-foot separation. But it did allow those non-essential retail stores to at least start providing some services again. It also reclassified the greenhouses, garden centers, and nurseries to operate as an essential business. Again, they would still need to follow the social distancing guidance that's out there. If you're within 6 feet of an employee or a customer, then to wear a face covering. But they are allowed to be open more, having people inside those areas, not just the pickup and delivery that was there before. So also pet groomers were included in that. So many people's pets are very important to them and they may need grooming or nails trimmed, things like that. So they will be able to get their groomers. I know many of them are booking out and trying to make appointments to get your furry friends in there to get them treated accordingly. 2 other outdoor activities as far as opening on here is golf courses were also allowed to reopen following some fairly specific guidelines for social distancing and things such as like turning the cups over on the greens or putting in a pool noodle in there so everybody wasn't touching the flag stick, but being able to still have their golf rounds, keeping it to not sharing a cart if they are allowing a cart. Most of it was walking that they were promoting on there, but if someone had disability or needing a riding cart, that was an option, just keeping the distancing and having sounded like 1 person per cart on that is what they were looking for. In addition, fishing and boating, the boating requirements I know out there, they've put out that 2 people or less in a boat. I know that's been kind of a conflicting controversy. I've seen a lot of that out there on social media, regarding that aspect. And I really believe it was put in for the 2 group I think was out there as far as just ease of seeing 2 people in a boat versus 4. I've heard 4 or 5 people in my family. Why can't we all be in the same boat? I think it was more for ease of seeing how many people were in a boat. I don't know that for sure. But again, I'm just kind of going off of what I think on that frequently asked question. But there is definitely the boating of 2 or less is what the governor put out for that requirement. Some of the other things just real quickly on here for essential stores was, again, I know I put out as far as anyone out in the public wearing a face covering now. If you're going outside, if you're over 2 years old, as long as you don't have a medical condition that would prevent you from wearing that face covering out there. When you go into the stores, so they're basically saying that that's required now, unless you can keep that 6-foot distance, but I know almost every store is asking that you're wearing that face covering while you're inside of those now. The aisles kind of been going on for a while as far as kind of designating them as one way. Again, you're trying to maximize the space between you and the next shopper on there, and just making signage and things like that available in there.
Hey, Greg, question. I keep hearing the word guidelines. So let's say I'm golfing and I'm with my buddy or boating. That'd probably be more appropriate for me. I'm on a boat and there's 4 of us in the boat. Am I going to be arrested and thrown in jail, or is it, as I interpret the word guidelines, meaning, look, we're strongly encouraging people to do this?
Right. I don't have a great answer to that. I think it's going to be up to the individual law enforcement officer that may be out there at that time, whether or not they would actually issue a ticket, for the violation like that. I think a lot of it is trying to do more education on that front. And if they see that, really trying to tell people, hey, the guideline is 2, you know, you need to separate or, you know, take turns on this, but I'm not sure exactly how that, as far as enforcement, you know, exactly what would happen there.
And then,
Greg, I'm kind of curious I'm sorry, Cohen, if you had a follow-up, go ahead.
nope.
Okay. So let's take a garden center, for example. If I'm outside, do I need to wear the mask if I have that social distancing?
Again, according to this guidance, if you have that social distance, you would not have to wear that. But
If you're outside, but if you're inside,
you're
absolutely.
outside, correct.
Okay.
But individual businesses can also be stricter than these guidelines that the state put out. I have seen a lot of them have required a mask even in an outdoor area, but that it doesn't mean that you would have to. It basically says if you're outdoors, if you can maintain that 6-foot separation, then you would not need to have a mask or a face covering, I guess.
But as an employer, am I going to have my people wear masks, whether inside or outside?
It really comes down to keeping that distancing. However, in our aspect, I would say as an employee, having your employees there, I think it's going to be very difficult to always keep that 6-foot distancing there, unless they're, especially in a retail type environment,
Right.
versus more of an office setting. You know, I think there you can separate yourself and have that distancing, but I think in the retail environment, it'd be very difficult to keep without some sort of a face covering, to keep that distance between either an employee and or then customers coming in and out. Because I guess one thing to kind of really consider is that face covering, the typeset, like a fabric type covering there that we're asking, is more to keep your germs to yourself than it is preventing it from anything else getting into you. So if each person, if they both have that covering on, you're reducing the germs from essentially getting out from you. If you cough or sneeze, most of it's going to get captured by that face covering that you're wearing and or the person standing next to you.
Okay. And I know we want to move on to Lisa, but one last question. So is there a reward for turning someone in for not doing it? You know, a lot of people out of work, you're looking for income some way. Is there some kind of reward that you get for turning somebody in?
Not that I'm aware of. No, I mean, I don't think that's what anybody's looking for. I mean, as far as having that, and there's no reward program that I'm aware of that I guess would provide some sort of economic
relief.
You know, yeah, really just, you know, come back and say, hey, I get $25 because I just turned in my neighbor. I mean, no, I mean, that's not that I'm aware of.
The lack of reward isn't stopping people from calling city managers and police chiefs right now, though.
That's also true.
For sure. Hey, right, sorry, Lisa, right before we get to you. So just so I understand, you know, I'm an office, I'm considered an essential business because we're an IT company, a technology company, and we're taking care of other essential businesses right now. So in my office, you know, if we go on site, I have provided gloves, masks, hand sanitizer, everything for my people to protect my staff and my clients when we go into their locations. But in the office itself, we do not have a requirement on wearing masks. We encourage social distancing, and we, for the most part, we're able to abide by that because of the size of our office. Am I okay? Am I doing my due diligence then? I've got Clorox wipes, hand sanitizers, disinfectant soap. I bleach the whole place every day. They've got masks, they got gloves, so they could wear it. But am I okay? Am I doing what's good as a business owner then?
Right. I mean, to me, what you've described is a good practice to have. I mean, you've got like you said, the mask and gloves there if you're going out, that you need to be in someone's home or business to work with. You know, I would just say definitely maybe just keep an eye on that you are cognizant at least of the fact that when you're getting close in an office, sometimes we all get a little sidetracked if we might right next to a buddy talking and, you know, our coworkers, just that, really try to discourage that without wearing a mask. Again, to kind of keep your own germs to yourself in that aspect. That we really want to encourage everyone just to, if they are going to get up and move around out of their space, again, have that mask available to them to wear. I know, like here at the health department, when we leave our desk, our office space here, we all have a mask that we're putting on, or if we're going to have a meeting where we may even bump into, not even just that we know we're going to, but kind of once we leave, we put that mask on to at least have that, we have that available to us should we then run into somebody else in the office that we're just going to bump into, we have that on. So.
Excellent. Yeah, I was thinking we could have yardsticks to measure, but then in here it'd probably be lightsabers, knowing these guys. All right, I appreciate it. I appreciate it.
Don't you have something about social distancing?
I do. If you need a guide, right behind me here. One of the questions that came up yesterday, Greg, and I don't know if you can even answer this, was what do you do if someone refuses to wear a mask, whether it be a customer coming into your store or one of your employees? Is there anything that a business owner can do?
Well, I would say on that, the policies, each policy per business is going to kind of be up to that business to decide, and their legal framework, how they want to handle, especially an employee, on that, whether or not they're following guidelines or rules that you've put in place there. As far as customers, I think on that, you really kind of got to go back to setting your own guidelines there. And if you don't feel, I guess, comfortable with that employee or I'm sorry, that customer coming in, then I think, you always have the right to, not that anybody wants to, but to tell the person, please leave. I'm sorry, you can't shop here today. We can't do business unless you want to put on, some sort of a face covering. Again, I do want to point out there are a couple exceptions to that face covering. Again, if there's a medical reason why they cannot wear a mask or a face covering, then, that may be a time where then you do allow that person in, but then really paying attention to keeping that distance, the greater the 6 foot distance there, and maybe isolating them a little bit more in the store than somebody who's wearing a face covering. Does that answer your question?
Yeah, I think so. I think everyone's just really doesn't want to have to be their own, vigilante and not sure what extreme, you're required to go to either. So thank you.
Yeah, because we've already heard the stories locally of, the guy saying, this is America, I can come in, it's my health. But then businesses got to remember, yeah, this is America and you can refuse service.
Right.
We can set our standards, and if people aren't going to abide by it, then we do not have to serve them. But you're right, there's some exceptions out there, but it's good for businesses to know you need to protect your people and your clients too, and you can.
Right.
So if someone is not going to do their due diligence, you don't need to expose them to the rest of your staff and your clients.
This fall under no shoes, no shirts, no service.
Yeah,
absolutely.
Good point. Good point. All right, Lisa.
Yeah, I just wanted to piggyback on the mask conversation. I can tell you from more recent outbreak investigations that we've done within businesses in our community, there's a big difference about the outcomes of those outbreaks when we look at people who are doing things the right way and according to the guidance, and those who are maybe a little more loose in how they're adhering to that guidance. So yes, if you're in an office and you can maintain that 6 foot distance, technically you'd be okay. But there is evidence to show that if you're wearing a mask, you're much less likely to be touching your own face. And even though you may not cross each other within 6 feet, you are oftentimes touching the same surfaces. And so if you're touching and then you're touching your face when you're back to your desk, that's part of the reason why the masks work too, is because you're less likely to expose yourself to maybe a surface that you shared with one of your coworkers. So just a quick, I'll get off that soapbox now. But my part of the discussion today, I just wanted to talk a little bit about the new Restore Illinois framework that was rolled out yesterday by the governor's office. And as you can imagine, since this is rather new, Public health learned about it when the press briefing happened at 2:30 yesterday. We didn't know about it before. And so we're just trying to sort of sift through it. But we have been part of a phone conference earlier today to sort of give a little bit more insight as far as what that will look like moving forward. So if you haven't seen the framework, you know, looks something like this. It's available online. And you know, as far as where we are currently in that framework, you know, phase 1 is rapid spread. The good news is that we have already in Illinois moved to phase 2, where we're starting to move into the phase, it's called the flattening phase. So we're in that phase currently. And that's why the guidance changed as of May 1st and the restrictions started to loosen up a little bit. Keep in mind that they've made it very clear that as we move through these phases, you can move forward, ideally, but you could also need to move backwards in the phases if we don't do it slowly and correctly. So the more people, we believe that the more people who wear masks religiously when they're out and about, the more likely we are to be able to move through these phases forward versus having to go back and forth. So at any time, we could have to go backwards. In order to prevent going backwards, they're really trying to slowly roll this out so that we don't move too quickly and end up having to move in the wrong direction. So the Department of Public Health has put out the guidance related to what that means from the public health approach, but also has released their data information related to the metrics that they're going to be following when they make these decisions on when to move to the next phase. So those of you, any of you who've read it, know that DeKalb County falls into the North Central region, so it's EMS regions 1 and 2. And so it's likely because Winnebago County is the largest county in that area, they will sort of be our gauge as far as when we move as a region. It sounded pretty clear yesterday at the governor's briefing that it will not be county by county. It will go region by region as far as how we move through the phases. So we will be looking closely at our data as we are now, but also be looking at what's happening in Winnebago County being the largest and most populated county in that region. So with the phase, since we're in phase 2, that's really what I want to focus on today, rather than trying to get ahead of ourselves and go too far into it. But there really are 3 different reasons why or criteria in order to move to the next phase. So to move into phase 3 when even more things are able to open up, businesses and otherwise, that we have to be at or under 20% positivity rate. So looking at the total number of tests versus how many tests positive, and increasing no more than 10 percentage points over a 14-day period. So if you monitor those metrics that are available on the State Health Department's website, they've started May 1st, and you'll be able to see and monitor how we rate in Region 1, in our region. Are you
guys gonna post those on your website too, or
yes, we'll be pushing that information out.
Okay.
We also want we would want no overall increase in hospitalization admissions for COVID-19-like illness for 28 days. So keep in mind that 28-day period. We would have to be monitoring for those 28 days to make sure that the hospitalizations did not increase. So they either stabilized or started to decrease over a 28-day period. Plus, we have to be sure that our available surge capacity of at least 14% of ICU beds, medical and surgical beds, and ventilators. And so the dashboard or the data that they've created in the metrics on their website show those different categories and show where our region rates currently, and in the consumers or the public can sort of monitor that on a regular basis as soon as that is updated. And so that's what we'll be watching as well, and working with our regional health departments to determine what's next. The good news is that testing has improved dramatically over the past few weeks. We now have local testing at Physicians Immediate Care. It's a rapid test. We have a couple of regional sites, drive-through sites that have opened up in Aurora and in Rockford. So if people need tests right now, they're likely to be able to have access to them. And that's one of those criteria that have to occur in order for us to be able to continue to move forward in the phases. So that is a really positive thing. We also know that, at least in Winnebago County, from a conversation that we had earlier this week, that they really are moving towards their peak. That peak has flattened some, but they're moving towards, so their cases are still rising, but they do anticipate in the next week or so that they will be getting at that peak of illness. We also are working a lot on contact tracing. So each health department is responsible for the cases that are showing up in their county. And we have to be sure that we can continue to trace, contact trace and monitor within 24 hours of diagnosis. So the state health department is looking at when the cases are reported to the health departments and how soon it is that we get a hold of them and begin that contact tracing. So as long as the region can keep up doing that with the number of cases coming in, that will be another criteria as far as how we move to the next phase. We want to make sure that we are very careful. I know I've already said this, but I'll say it again, that we're very careful not to try to move too quickly, because our fear is that we'll end up going backwards. All of us want our kids back to school. All of us want the businesses to open back up. We all want to go to restaurants. We all want to go shopping in a store again. So we really need to think very carefully on how we move. The question came up on a conference call today about who makes the decision when each region can move. That really still is the governor, and in consultation with the Department of Public Health, who would be in consultation with the local health departments in that region. And so it really is a decision that's made at the state level. However, there's a lot of feedback that goes into that from the local level. So that's really all I wanted to highlight as far as just the current status. This is where we're at. We're still trying to weed through all of the information, looking at the data on a regular basis, and trying to make sure that we're able to push out what we can. The health department does have a weekly newsletter that you can sign up for on our website. We also have a business distribution list for emails when new guidance comes out. That's how we push it out. So we're happy to add people to that. You can just email covid19@dekalbcounty.org to ask for your names or your organizations to be listed on those distribution lists. So if you want it only to be on a business distribution list, you would only get an email when new guidance came out. Or if you want to just have our weekly update, which updates you on cases and it updates you on this sort of information about the metrics available on the website, so on and so forth. So be sure that you go onto our website and sign up, because that's really how we push out the information in a real-time way.
Lisa, I have a question about the 28-day period you mentioned there.
Yeah.
So we have to be, hospital admissions have to reduce in 28 days before we can go to the next stage?
They have to be stable or declining for a full 28 days.
So do we know where we are in that 28-day period now? Or did it start on May 1st? And therefore, is the earliest possible day we could be in step 3 is May 28th?
Exactly.
Okay.
That's correct.
And where are we at? Are we increasing? Are we stabilized? Are we decreasing? Do you know, for our region?
It looks like we are at minimum stabilized right now for the whole region, if you look at the entire region. Like I said, that dashboard is really helpful. It only has data from May 1st through May 4th right now, but they will be adding to that daily in order to keep that up to date. So we should be monitoring that. That's what we'll be doing too. Those data points are sort of what we're trying to figure out, make sure that we are pushing out the most current information, but that is monitored at a state level through the electronic reporting system that they use.
Lisa,
And that just gets us to phase 3 then.
Correct.
The earliest we get to phase 3 is May 28th.
That's correct.
Wow.
Lisa, it seems as in the past, more testing became available and then more people had the virus. Would you agree with that?
Well, not that they had the virus, just that they
Tested
were
positive.
confirmed they had the virus.
Okay.
Yes.
So if that is what historically is what happened, are we ever going to get out of phase 2? Because the more testing we do, the more positive tests are going to come back.
Right, but they're looking at the positivity rate. So they're looking at all of those who were tested and how many of those that were tested showed positive. We get a lot of negative results, folks. There's so many negative results that come through as well. We have started to report those negative results out to the community via the newsletter weekly. So you are able to see that. But so that's the answer, is that they're looking at not the number of positives, but the positivity rate in the community.
Okay.
The only problem with that, though, wouldn't it be that the people that are going to get tested are the ones that think they might have it?
Well, you would think that, but we have a lot of negatives still coming through every single day. In fact, way more negatives than positives. So.
Is there a URL that people can go to see these stats up to the minute?
Yeah. The URL is dph.illinois.gov/COVID-19.
Okay. Would you repeat it just one more time?
Sure. dph.illinois.gov/COVID-19.
Thank you. So, Winnebago County, you said, is the leader of the pack for Zone 1. Is that right?
Yeah, we would think that it was, just solely based on population.
Okay. And how many deaths have they had? Do you know offhand?
I don't know offhand. I'd have to look it up.
Okay. Because I was looking in the Chronicle, and Winnebago's not in the chart that they have printed. Okay. Bill, you have something else. I know it.
I have something else. What's that?
Just say, I mean, questions.
Yeah, well, I know Lisa talked about you didn't want to get too far ahead, but a lot of us want to get a little far ahead, Lisa, with just some ideas. So I know, Bill, being from the restaurant industry, I'm sure you've got a bunch of questions that you might want to just get some guidance on right now, or some thoughts.
Well, I can just to sort of lead into that discussion. We are getting a lot of calls from a lot of different businesses in the community. We're reaching out to some of them because we're starting to see some COVID activity within those businesses that are open. But even those businesses that are closed, we are a resource. We have done, walkthroughs of businesses who want to open, who are planning to open, to give just some, guidance based on the guidelines that exist about, social distancing mainly, precautions that they can put in place, things about where should I put a barrier, a sneeze guard of some sort, how should I mark my floors to be ready to open when I can open. So we have started to talk to people about what will reopening look like, even though we don't know exactly when. We are more than happy to talk through, once you have a plan in place and even maybe started to get ready to implement that plan, we can talk to you, and we have a few members of staff who are sort of assigned to help out with that. So hopefully, even though we don't have the formal guidance in many cases, we have enough, baseline knowledge that we can usually provide some pretty good ideas on how to get started.
Who would they contact directly?
They can email that COVID-19@DeKalbCounty.org.
Okay.
It's monitored by several people all day long.
And is there, along with those kinds of guidelines that you're providing on a voluntary basis, is there something about cleaning and disinfecting also?
Absolutely. We have worked with a lot of different organizations, most who are open right now, on giving them guidance on, how to make a bleach solution, when and how frequently they should be sanitizing and disinfecting. The CDC has most of that guidance available, but we're able to talk through that with people and help them if they need help. We also have some supplies of an 80% alcohol-based sanitizer spray that we've been providing as supplies last to people if they ask.
And speaking of sprays, I mean, I've read a lot of different information. Is it true that it needs to stay on the surface for 5 minutes before it could be dried off? Or is that just one of those things that people are saying?
Greg, do you want to speak on that?
That would actually depend upon the sanitizer or the product that you're using. So there's not one universal answer to that question. It really depends on what's being used, on the length of time that it would have to sit wet, per se, on there before being, wiped off. So that's going to vary depending on what product you're using, but we'd be happy to walk through that with anyone if they have questions, to answer those questions specifically.
Lisa, looking ahead to, you said, what is it going to look like to open? And I know restaurants would be in stage 4, but is it something that restaurateurs, can I call up the health department and say, what's the plan going to be? Are you going to require an inspection? Do we need additional training for our staff before we can open? Are there any plans down the road for that.
Greg, do you want to speak on what, I mean, it's all guessing right now because the guidance isn't out yet, but I mean, on a short answer, we would be able to assist with answering questions, even with coming on site. I'm not sure if those will be mandated to open back up. We haven't gotten that guidance yet. Greg, anything more on that?
No, my initial thought on that is more, just like you said, Lisa, just that we would be glad to provide that, assistance in interpreting those rules whenever they came out. I don't see it at this point, at least being mandatory, before you would reopen, but I guess we'll kind of all wait and see a little bit on that, just what the state puts out as more guidance to us to be able to fully answer that question.
We're in the restaurant industry. We're watching Iowa. Iowa's allowed to reopen their restaurants, and they can operate at 50% capacity. Mm-hmm. Is that something? I know that my capacity over at Lincoln is 136. So can I just say, okay, 72 people, and then we can open, or do we have to get a table layout approved by the health department or by somebody?
I think you're looking at, like you said, that 50% capacity is a lot of what I'm seeing too in other states, and some of the verbiage on the Restore Illinois document too that's out there kind of talks about 50%, or in the essential services document having that at like 50% capacity. I think the only thing as far as layout and stuff is trying to keep in mind that you want that spacing in between different customer tables. So you don't want to set somebody right beside one another in there where you would maybe like every other table, or you're going to want to still try to keep that 6-foot social distance, which I believe is probably the basis behind that 50%, is that you can do like every other or every two, in order to keep that distance guideline.
Okay.
Does the health department have any idea if there's going to be certifications for opening up? We're all consumers. We're going to feel a lot better if we can go into a place and it's certified that everything's okay to open up. Is there anything planned for that, to try to help the consumers feel better about all this?
I guess I would say at this time, no, but it's a great suggestion to have for us to take back.
That's not mandated from what I'm hearing, but I know from an operator point of view, we need, as a restaurateur, I need to make you feel safe. I need to make
right
that they can come back to work. So you're not going to require some things, but there are definitely things on my queue that were, definitely visible hand sanitization, protective gear. Whether or not you believe in the mask or not, we're wearing it because we want you to know that we care behind the scenes for what you don't see. So these things are going to happen there. What the gray areas where we're going to have it on the wellness checks. We're going to temp our employees when they come in. Then the question, which I think you asked earlier, do employees wear a mask? Well, at the Lincoln Inn, yes, you wear a mask because Bill says you wear a mask. Now, does a customer have to wear a mask? That's a different thing. The question is will there be wellness checks for customers? That's where something would be nice if the state would come out and just say yes or no. Because if the state says yes, well, then that takes the burden off of my back. I have to temp everybody that comes in.
I would guess that the state, when they put out the guidance for restaurants specifically, or businesses, that would be part of it. But I would say that, the temperature checks are only as good as those who maybe have a temperature associated with COVID. Okay. Well, I think I'm probably stating the obvious, but what we're seeing is there's so many cases that may not have fever, that are maybe walking around completely asymptomatic. They're really noticing it more as they're starting to test maybe larger facilities, where the person may have, we had a case recently where the only thing the person had was they lost their sense of smell. That's it. There was no other symptoms at all, but they were a positive COVID test. And so, having signage out front of your business that says, stop, if you have any symptoms, here's the list, please do not come in, might be as effective as doing a temperature check based on what they know now from the cases that we've seen. But I would guess that that wellness check of employees would definitely be a component that will show up in the guidance. So, you know, screen at minimum, screening your staff and encouraging them highly to stay home if they're sick, and incorporating policies that allow for that versus penalize that would be, I think, equally, if not more important than that temperature check at the beginning of each shift. But, you know, I'm not sure what the guidance will say exactly.
Since we do have some time, and Bill brought up a point that seems to continue to come up about a certification. I mean, the health department does have some time to maybe work with, you know, some businesses to get an idea of what those guidelines might look like. But it seems like it'd be really cool if you guys did have something that, if they did these 10 things, you're giving them not a stamp of approval, not a it's safe from COVID sign, but something that says, look, they went above and beyond and actually worked with the health department to earn this thing in the window, that us as consumers, when we go places, when we see that, it's like, okay, I'm going to go there because they're obviously going the extra lengths to take care of me. Where what Bill's talking about, I'm not going to know it until I walk into Lincoln and see it. So it'd be neat to have something that they put on their website, something they put in their newsletters, and maybe on their window. Any thoughts or interest in maybe pursuing anything like that? Not to put you on the spot. I'm sorry about that.
The only thing I can say is, you know, that is an interesting idea. I would worry a little bit about just capacity, because as you are opening up, we are opening up to the health department. Meaning right now, for example, Greg's staff are doing fewer restaurant inspections because of everything that's going on. And so therefore we're behind. Our clinical staff are doing appointments still, but in a different way. But once business starts to open back up, our model will open up too. So I'd worry a little bit about capacity, but I do think that it's valuable enough that we should at least take it back to our health department emergency operations team and sort of bounce it around a little bit about what would that look like, and how would we have the capacity moving forward to do something like that. It's a very interesting concept. We hadn't thought about it until you mentioned it.
Yeah, you know, Lisa, it could be something as simple as we follow the DeKalb County Health Department's guidelines. Mm-hmm. So it's an honor system, right?
Yeah.
It's something like my open for business sign. This is what all it's an Illinois initiative right now, that if you're open or not, but open means a variety of things, right? That could be something that at least give consumers a little like, okay, we know there's no regulation going on. The health department's not inspecting each one of these, but this business is making a claim that they're doing these things.
Yep.
And I'm going to know it once I go inside.
Yeah, I like that idea. Let us bounce it around a little bit, and we can go from there. I just wanted to mention one other thing before we would finish here about masks. You know, I'm sure you looked at the recent plans, and it really does look like masks are going to be part of our regular life when we're out and about for a long time now. I think the soonest we could see a vaccine is maybe early 2021, I'm hoping. And so really they're saying until there's a really effective treatment or a vaccine to prevent it, mask is just gonna be part of daily business. Obviously, when you're in a restaurant and eating, you're not wearing a mask. However, you know, any business who's closed right now who's planning to open should have a plan for masking. They should have a plan for masking their own employees, and they should have a plan for, enforcing a policy for the customers who they serve to wear a mask, whether they provide it to the customer or whether they require the customer to have one. It's really going to be part of our daily lives now for the foreseeable future. I could even see when schools open back up that masks, if they do open back up in the fall, that masks will likely be part of that plan. So just making sure you have a plan. For most people, cloth masks work just fine. So any kind of face covering will work. The N95s definitely should be safe for healthcare workers. And even the surgical masks, you know, we're trying to distribute the supply that we have to healthcare workers or those who work in more high-risk settings. So a face covering could be, it's a very general term because you can use a lot of different things for that purpose. So just wanted to give the masks one more plug.
It's ironic you said that, Lisa. Just as you said that, I got a text from a supplier, Performance Food Services, and they said we had talked about masks this morning. He says masks came in today. You can get a case for $55, limit one per order.
Yeah. I mean, I'm getting sales emails. Oh my gosh, I never gotten so many in my life. But there's all sorts of people. Just be careful when if you're purchasing masks that you're checking the supplier, making sure they're legit, because there's a lot of fraud happening out there too with supplies.
We have plenty of local businesses. I know Jim at OLT Marketing is doing them with your logo on them. We just ordered some for the DeKalb County Convention and Visitors Bureau. So
Very good.
one last question. If a worker tests positive at a business, what's required to be done? And then the second part of that is there a shutdown period, and do you have to close off the area where they worked, or what's sort of the protocol for that? And I know I heard you on a call on Friday talk about if there's 2 or more that are diagnosed, that's considered an outbreak then? Is that right?
That's correct. So in any business or organization, the criteria for an outbreak is 2 cases. So when that happens, typically we would know, maybe at the same time the business would know. And we'd be contacting the patient themselves, the person themselves, and we'd be immediately finding out who are they in close contact with. So whether the business reach out to us first or whether we reach out to them, it really just depends on the timing of when we're notified. But as far as what happens then, it really is a case-by-case basis, because every business, Cohen in his business, he's able to separate 6 feet. So if he came down positive, it would likely be that business could be as usual, but he'd go home for 14 days. But if you're in a manufacturer, for example, where you're having employees you can't space 6 foot apart, then the answer is different. We'd be saying how many people were within 6 feet of you for more than 10 minutes at any given time. But we would do our best not to shut down the facility. We would be doing a case investigation. We'd be finding out who those close contacts are. We'd be isolating the employee, quarantining those who were close contacts to the employee, and we'd be likely doing a site visit to help that employer sort of know what they can improve on to prevent future spread or further spread of the virus within the business. And so it's not a clear-cut answer. In fact, every time we've seen this, the answer has looked a little bit different. So it really would be just be open, contact us, be proactive. Don't try to hide anything, because we find out because we get the test results. And also, the quicker you let us know, the faster we can help you in preventing the spread further.
Great, thank you.
Anything else on that, Greg?
No, I mean, obviously, yes, there is some cleaning and sanitizing, perhaps, in that area. But again, it depends on the situation and, what we have. And we have started this week with, places that would have more than 2, going into those facilities and making recommendations to them. And because as Lisa said, just be open, be honest. I mean, we're here to help you as much as possible. We're not trying to be punitive in any way. We all just want to keep, you included, everybody wants to keep everybody safe. So that's all we're trying to do.
Sorry, go ahead, Jock.
No, go ahead, Court.
There's one more question did come in, and but if you are on the same topic, Jock, do you want to go in?
No, go ahead.
And I know the Sycamore Park District just announced this week that their pool is going to be closed, and this is for the entire summer around those, that topic. It says, we're seeing announcements that community pools and summer activities and camps are being canceled in various parts of the county. What are the regulations and health issues around this? And how does that also apply to business and community activities or events? I would assume this is part of, would have to go back to the whole governor's phase plan, correct?
It would.
Yeah, go ahead, Greg.
I was just going to say, yes, it would definitely go back to the phase plan with the governor. And I think looking at that, just as far as the group sizing that's in that phase, those phases, it really, until we get to phase 4, which is going to be out there a while, that's where you're looking at groups of 50 or fewer. And then phase 5 is really more than 50. So if you look at it from that angle of at least the current Restored Illinois plan that's out there, you're not going to see large activities or groups anytime soon, the way it looks on this.
I always have a bizarre question for everyone that comes onto the show, so I don't want this to be an exception. So who is going to do the enforcing if someone does violate the order? Is it the police? Is it you?
We usually start with, if we get a complaint called in, I'll tell you how we're handling it right now. As we get complaints called in, we are responding to those. Some of them are a site visit. Some of them are phone calls. It really depends on the situation. We're trying to, I guess, give everyone the benefit of the doubt that maybe they just don't know about the guidance. Trying to educate them on what the current guidance is out there that we're getting from the state. And then if we do see like continued non-compliance, especially if it's something that the health department has some direct regulatory authority, or say a food establishment or some pools, things like that, then we're basically taking that up, depending on the situation. And again, that continued non-compliance is something that we would run by our state's attorney's office to see if they wish to further, I guess, prosecute that violation, in accordance with the governor's order as far as compliance on there. I know some law enforcement has been involved in different areas, looking at least reminding people, hey, you need to separate, or this business can't be fully open for business, or whatever it may be. I know various around the county, I have heard that, they are taking that involvement from the law enforcement side, but most of it has all been really just trying to gain that compliance and educate the person rather than trying to be punitive. I mean, it's kind of a last resort for everyone.
Thank you.
Mm-hmm.
All right. I'm going to go ahead and wrap up the webinar at this point to be conscious of everyone's time. I got to say, absolutely, thank you, Lisa and Greg. You two were wonderful. And I really hope we can invite you on as we move from phase to phase on or about those transition periods, because there's going to be a ton of questions. So I'd really appreciate it if we could see you again. We will do everything we can to help get the word out, which in turn is just going to help you and your organization and help keep DeKalb County safe. So once again, thank you so much to Lisa and Greg from the DeKalb County Health Department. Thanks, Dr. Jock Sommese with the Small Business Development Center, Bill McMahon from the Lincoln Inn and Faranda's Banquet Center, and then Courtney Strohacker from the DeKalb County Convention and Visitors Bureau. I'm Cohen Barnes with Sundog IT, and I just want to remind everyone, DeKalbCountyUnites.com. Go there, check it out, wealth of information. And this video will be recorded and posted on DeKalbCountyUnites.com. There'll be a link taking you to the YouTube channel, and you can watch that. I would highly encourage you to share it to anyone you know that you might think would find value to this. Otherwise, I look forward to seeing everyone this Friday at 2 p.m. for our next webinar, our Small Business Spotlight. Got some retailers coming on with a really wide variety of neat ideas of how they adapted to this crisis. So it should be just a wonderful seminar, as it usually is. So that's it. Once again, thanks everyone, and have a healthy and safe week. Take care now.